August 15, 1944. The makeshift field hospital near Saint-Vith, Belgium, buzzed with desperate activity as Army Nurse Lieutenant Catherine Kate Sullivan pressed a blood-soaked bandage against a young soldier's chest wound. The acrid smell of sulfur and smoke drifted through the canvas walls, mixing with the antiseptic tang that had become her world for the past 18 months. "Dr. Morrison, we need plasma here," Kate called across the crowded tent, her voice steady despite the chaos surrounding them. Captain Thomas Morrison looked up from the soldier he was treating, his surgical mask unable to hide the concern in his dark eyes as they met hers across the makeshift operating table. Kate had arrived at the 67th Evacuation Hospital 3 weeks earlier, transferred from a base hospital in England where the wounded came clean and categorized. Here, barely 10 miles from the German lines, casualties arrived covered in mud and blood, their injuries telling stories of desperate battles fought in hedgerows and shell-torn fields. Coming right up, "Lieutenant," called Corporal Jimmy Martinez from the supplies corner, his usual cheerful demeanor intact despite the endless stream of wounded flowing through their doors. The 19-year-old medic from Los Angeles had become the heart of their small unit, somehow maintaining hope in a place where hope seemed as scarce as morphine. Captain Morrison moved with the practiced efficiency of a surgeon who had learned his craft in the crucible of war. At 31, he possessed hands that could repair what artillery had torn apart, and eyes that could see hope where others saw only loss. Before the war, he had been chief of surgery at Presbyterian Hospital in Chicago, living a comfortable life that now seemed like someone else's memory. "Kate," he said softly as he passed her station, using her first name in a way that made her pulse quicken, despite the professional setting. "After we finish with this batch, I need to speak with you about the new protocols from headquarters." The way he said her name carried undertones that had nothing to do with military procedure. Over the past 3 weeks, their professional partnership had evolved into something deeper, though neither had spoken of it directly. In a world where death arrived daily, acknowledging personal feelings seemed both precious and dangerous. The afternoon brought a lull that allowed the medical staff to catch their breath and process the morning's casualties. Kate found herself in the small area behind the main tent that served as their break room, washing her hands in a basin of precious clean water when Captain Morrison appeared beside her. "The protocols," she reminded him, though her eyes suggested she hoped he had more personal matters to discuss. "Kate," Thomas began, then paused as if weighing his words carefully. "Command has decided to establish a forward aid station closer to the lines. They're requesting our best nurses for the assignment." The implications struck her immediately. A forward aid station meant working directly behind the front lines, treating casualties within minutes of injury rather than hours. It was dangerous work that could save lives by providing immediate care. But it also meant leaving the relative safety of the evacuation hospital. "They've specifically requested you," Thomas continued, his voice carrying concern that transcended professional considerations. "Your work here has been exceptional. But Kate, I need you to know that accepting this assignment means—" "Means what, Thomas?" The use of his first name hung between them like a bridge they had been afraid to cross. "It means I might lose the best nurse I've ever worked with," he said quietly. "And it means I might lose something else that's become very important to me." The admission hung in the air between them, weighted with implications that went far beyond military assignments. Kate felt her heart racing as she realized he was acknowledging the feelings that had been growing between them through weeks of shared purpose and mutual respect. "What exactly are you saying, Captain?" she asked, though her eyes already knew the answer. Thomas stepped closer, his voice dropping to barely above a whisper. "I'm saying that somewhere between saving lives and watching you work miracles with impossible cases, I've fallen in love with you, Kate Sullivan." And the thought of you heading toward the front lines terrifies me more than any enemy artillery." The confession struck Kate with the force of recognition. She had been fighting the same feelings, pushing down the growing attraction she felt for this dedicated surgeon who treated every wounded soldier as if they were his own brother. "Thomas," she whispered, her voice carrying both joy and anguish. "I've been trying not to admit to myself that I love you too, but in a place like this, with everything so uncertain—" "That's exactly why we have to acknowledge it," he interrupted gently. "Because uncertainty is all we have. Tomorrow isn't guaranteed for any of us." Before she could respond, the sound of approaching vehicles announced another convoy of wounded. Their moment of personal connection was interrupted by the demands of duty, but something fundamental had changed between them. Working side by side through the evening, Kate and Thomas moved with an enhanced synchronization that seemed to flow from their acknowledged feelings. Other staff members noticed the change. Glances that lingered a moment longer, touches that conveyed more than professional necessity, a harmony that made their medical partnership even more effective. Corporal Martinez, cleaning instruments nearby, caught Kate's eye and grinned. "You know, Lieutenant, I've been watching medical teams work together for 2 years now, and I've never seen anything like what you and the doc have." "It's like you can read each other's minds." Kate felt warmth spread through her chest at the observation. "We've developed a good working relationship, Corporal." "Ma'am, with respect, that's more than a working relationship," Martinez replied with the boldness of youth. "That's two people who care about each other, helping each other be better at what they do." That evening, as the last patient was stabilized and the immediate crisis had passed, Kate found herself walking through the small area behind the hospital tents, where supply crates created a makeshift seating area. Thomas appeared beside her, carrying 2 cups of coffee that had been brewed strong enough to strip paint. "Still thinking about the forward aid station assignment?" he asked, settling beside her on a wooden crate. "I have to take it, Thomas," Kate said quietly. "Those soldiers need immediate care, and I have the skills to provide it. I became a nurse to save lives, not to stay safe behind the lines." Thomas nodded, understanding even as his heart rebelled against the idea. "I know you do. It's one of the things I love about you. Your dedication to helping others regardless of personal risk." "But," Kate prompted, sensing the unfinished thought, "but I need you to know that when this war ends, I want to build a life with you," Thomas said, his voice carrying certainty that surprised them both. "I want to practice medicine in peacetime. Maybe start a family clinic where we can heal people without artillery shells falling around us." The vision he painted created a warm glow in Kate's chest. "That sounds like a beautiful dream, Thomas. But first, we have to survive this war." "Then promise me something," he said, reaching into his pocket and withdrawing a small silver locket that had belonged to his grandmother. "Promise me you'll carry this with you to the forward aid station. And promise me you'll come back to me when this war is over." Kate accepted the locket with trembling fingers, understanding that it represented more than a keepsake. It was a tangible connection between them, a symbol of their commitment to a future beyond the immediate dangers they faced. "I promise," she whispered, fastening the chain around her neck. "And I need you to promise me something too." "Anything." "Promise me you'll keep saving lives here, but you'll also keep yourself safe," Kate said, her voice carrying the authority of someone who understood the costs of war. "Because I need you to be there when I come back." The kiss they shared was gentle, but filled with promise, expressing emotions that words couldn't adequately convey. They were acknowledging love in the midst of war, finding hope for the future within the uncertainty of the present. 3 days later, Kate reported to Lieutenant Colonel Sarah Patterson, the chief nurse coordinator who was assembling the forward aid station team. Patterson, a career Army nurse who had served in North Africa and Italy, understood both the medical challenges and personal sacrifices the assignment would require. Lieutenant Sullivan, your record speaks for itself, Patterson began, reviewing Kate's file. Exemplary performance under pressure, innovative treatment approaches, and exceptional patient outcomes. The forward aid station will be challenging in ways you haven't experienced. I understand the risks. Ma'am, Kate replied with professional composure that masked her personal concerns about leaving Thomas. The position requires not just medical expertise, but leadership capability, Patterson continued. You'll be supervising a team of medics and corpsmen while working directly with frontline units. Are you prepared for that level of responsibility? Yes, ma'am. I've been preparing for increased responsibility since I enlisted. Patterson studied Kate with the appraising look of a veteran officer. There's something else, Lieutenant. Captain Morrison has requested permission to visit the forward aid station periodically to provide surgical consultation. His request has been approved. The news struck Kate with unexpected relief. While Thomas couldn't be permanently assigned to the forward station, knowing that he would be able to visit periodically provided comfort that made the assignment seem less like abandonment of their developing relationship. That's good news for our patients. Ma'am, Kate managed, keeping her voice professionally neutral despite her personal joy. Indeed it is, Patterson agreed, with a slight smile that suggested she understood more than her words indicated. Medical partnerships that work effectively should be maintained when possible. The Forward Aid Station, designated Medical Unit Alpha, was established in a reinforced bunker complex barely 2 miles behind the front lines. Kate arrived with a team of 6 medics and 2 corps men, along with the most portable medical equipment available. The facility represented the cutting edge of battlefield medicine. Immediate treatment that could mean the difference between life and death for critically wounded soldiers. Sergeant Robert Dutch Muller, a veteran medic from Minnesota, served as Kate's senior enlisted advisor. At 28, he possessed battlefield experience that complemented her medical training, creating a partnership based on mutual respect and shared dedication to saving lives. Lieutenant, we've got the trauma base set up according to your specifications, Dutch reported during their first day of operations. Plasma supplies are adequate, and we've got good communication with the evacuation hospital for surgical cases. Kate surveyed their new domain with satisfaction. The bunker provided protection from artillery while offering enough space for immediate trauma treatment. More importantly, their proximity to the front lines meant they could reach wounded soldiers within minutes rather than hours. How long has it been since we've had casualties, Sergeant? Kate asked, though she knew the answer would be measured in hours rather than days. About 6 hours, ma'am. But intelligence suggests the Germans are planning something big. Could be a long night ahead. As if summoned by his words, the sound of approaching artillery began echoing across the battlefield. Kate felt the familiar mixture of anxiety and adrenaline that preceded periods of intense medical activity. The first casualties arrived within 20 minutes, 3 soldiers from a forward observation post that had taken a direct hit from German mortars. Kate moved immediately into the focused state of mind that allowed her to assess injuries, prioritize treatment, and coordinate care while shells continued falling in the distance. Sergeant Mueller, this one needs immediate plasma, Kate called as she examined a soldier with severe abdominal wounds. And get word to Captain Morrison at the evacuation hospital. We're going to need surgical support within the hour. Working in the forward aid station pushed Kate's medical skills to their limits while testing her leadership abilities in ways she hadn't anticipated. Every decision carried immediate life or death consequences, and there was no time for doubt or hesitation. The rhythm of battlefield medicine consumed the next several hours. Wounded soldiers arrived in a steady stream, each presenting unique challenges that required rapid assessment and immediate intervention. Kate found herself drawing on every aspect of her training while adapting to circumstances no medical school could have prepared her for Captain Morrison, arrived just as Kate was stabilizing a soldier with multiple shrapnel wounds. His presence brought both professional reassurance and personal comfort that strengthened her confidence in the facility's capabilities. "How are you holding up?" Thomas asked quietly as they worked together on a particularly challenging case. "Better than I expected," Kate replied honestly. "The work is demanding, but knowing I'm making a real difference makes it worthwhile." "You're doing incredible work here, Kate," Thomas said with pride that transcended professional assessment. "These men owe their lives to your quick thinking and skilled care." The acknowledgement meant more to Kate than any official commendation could have provided. Knowing that Thomas respected her professional capabilities as much as he cared for her personally created a foundation for their relationship that could withstand the pressures of war. As autumn progressed into winter, Medical Unit Alpha became known throughout the division for exceptional patient outcomes and innovative treatment approaches. Kate's leadership had created a medical team that functioned with remarkable efficiency, despite the constant pressure of frontline conditions. The personal relationship between Kate and Thomas deepened through their periodic meetings at the Forward Aid Station. Their professional collaboration provided a framework for emotional intimacy that grew stronger with each shared crisis and mutual success. "I've been thinking about after the war," Thomas told Kate during one of his visits, as they shared a quiet moment between medical emergencies, "about what we talked about regarding a family clinic." "What specifically have you been thinking?" Kate asked, though her heart already raced with anticipation of his answer. "I've been thinking that Kate Morrison has a nice ring to it," he said with a smile that made her pulse quicken, "and that Dr. and Mrs. Morrison would make an excellent medical team in civilian practice." The proposal was informal but unmistakable. Kate felt tears gathering in her eyes as she realized that Thomas was asking her to marry him in the only way possible given their circumstances. "Is that your way of proposing to me, Captain Morrison?" she asked with a smile that illuminated her entire face. "It's my way of promising you that when this war ends, I want to spend the rest of my life loving you and working beside you," Thomas replied with certainty that left no room for doubt. "Then yes," Kate whispered. "Yes to all of it." The engagement, unofficial but heartfelt, provided them both with hope that extended beyond the immediate challenges of war. They were planning for a future that seemed more possible with each passing day as Allied forces continued their advance toward Germany. Christmas, 1944, brought both celebration and crisis to Medical Unit Alpha. A German counteroffensive in the Ardennes created the largest influx of casualties Kate's team had yet experienced, testing every aspect of their medical capabilities while demonstrating the strength of the partnerships they had built. Working around the clock for 3 consecutive days, Kate and her team treated over 200 wounded soldiers while maintaining patient outcomes that exceeded expectations. The crisis became a testament to their professional excellence and personal dedication. Thomas arrived on Christmas morning, bringing not just surgical expertise, but also a small package, wrapped in medical gauze that contained an engagement ring he had somehow acquired from a grateful French jeweler whose life the medical team had saved. "Merry Christmas, Kate," he said quietly, as he slipped the ring onto her finger during a brief lull in casualties. "Merry Christmas, Thomas," she replied, her voice catching with emotion, as she looked at the simple gold band that represented so much more than jewelry. The ring served as a tangible reminder of their commitment to each other and their shared vision of a future beyond war. Wearing it while treating wounded soldiers created a bridge between their present duties and their hoped-for future together. As 1945 dawned with increasing Allied momentum, Kate and Thomas began making concrete plans for their post-war life together. Their shared experiences in battlefield medicine had created a partnership that they both knew would translate effectively into civilian practice. I've been corresponding with a colleague about establishing a clinic in rural Wisconsin. Thomas told Kate during one of their planning sessions, "It's an area that needs medical services, and it would allow us to serve people who don't have easy access to health care." "That sounds perfect," Kate agreed. "After spending so much time treating trauma cases, I think I'd enjoy family medicine and preventive care." The vision of peaceful medical practice, treating ailments that weren't caused by enemy fire, seemed almost too good to believe. Yet, their shared dedication to healing and their proven ability to work together under pressure made their dreams seem achievable. March brought news that German resistance was collapsing across a broad front. Medical Unit Alpha's workload shifted from treating combat casualties to handling prisoners of war and displaced civilians who needed medical attention. Kate found herself treating German soldiers with the same dedication she provided to American troops, following the medical oath that made no distinction between friend and enemy when healing was required. The experience reinforced her understanding of medicine as a fundamentally humanitarian profession. "It's strange," she told Thomas during one of his visits, "treating people who were trying to kill our soldiers just days earlier. But when they're wounded and suffering, they're just patients who need help." "That's what makes you an exceptional nurse and an exceptional person," Thomas replied with admiration. "Your ability to see the humanity in everyone, regardless of circumstances." The acknowledgement strengthened Kate's confidence in her professional choices while confirming her belief that she and Thomas shared fundamental values that would sustain their relationship. Long after the war ended, April 1945 brought rumors of German surrender that created an atmosphere of cautious optimism throughout Allied forces. Medical units began preparing for the transition from combat operations to occupation duties, planning for challenges that would require different skills but equal dedication. Kate received orders to return to the evacuation hospital in preparation for redeployment to the Pacific Theater, where medical personnel were needed for the ongoing conflict with Japan. The prospect of continued separation from Thomas created anxiety that was tempered by their shared understanding that duty came first. "How do you feel about possible Pacific deployment?" Thomas asked during their last evening together at the forward aid station. "Nervous about being separated from you again," Kate admitted honestly. "But I know that if I'm needed in the Pacific, that's where I should go." "Whatever happens, we'll face it together," Thomas assured her. "Even if we're physically separated, we're partners in everything that matters." The promise provided comfort that sustained Kate through the uncertainty of potential reassignment. Their relationship had proven strong enough to survive separation and challenging circumstances, creating confidence that it could endure whatever challenges lay ahead. May 8, 1945, brought the long-awaited news of German surrender. Victory in Europe created celebrations throughout Allied forces, but it also brought the reality of continued war in the Pacific and uncertain timelines for return to civilian life. Kate and Thomas found themselves among the medical personnel selected for retention in Europe to handle ongoing occupation duties and the massive task of treating liberated prisoners and displaced persons. The assignment kept them together while providing meaningful work that utilized their combined expertise. Working in displaced persons camps, Kate encountered medical challenges that differed from battlefield trauma, but required equal skill and compassion. Treating survivors of concentration camps and prisoners of war exposed her to the full scope of war's human cost while demonstrating medicine's power to restore hope as well as health. "This work is as important as anything we did during combat operations," Kate told Thomas as they toured a newly established clinic for displaced persons. "These people need healing that goes beyond treating physical injuries." "You're right," Thomas agreed. Restoring someone's faith in humanity is just as vital as repairing their body. The insight reflected their shared understanding of medicine as a holistic profession that addressed human needs beyond immediate physical symptoms. Their work with displaced persons strengthened their commitment to providing comprehensive care in their planned civilian practice. August brought news of Japanese surrender, officially ending World War II and beginning the process of demobilization that would eventually allow Kate and Thomas to pursue their civilian dreams. The prospect of peace created both excitement and anxiety as they planned for a future that had seemed uncertain for so long. In 6 months, we could be Dr. and Mrs. Morrison running a family clinic in Wisconsin, Thomas said with wonder, as they walked through a peaceful German village where they had established a temporary medical facility. "It seems too good to be true," Kate replied, though her voice carried hope rather than doubt. "After everything we've been through, the idea of practicing medicine in peacetime feels almost miraculous." "We've earned our happiness, Kate," Thomas said with certainty. "We've served faithfully, saved lives, and proven that our partnership works under the most challenging circumstances imaginable." Their engagement period in occupied Germany provided opportunities to plan their wedding and future practice while continuing to serve patients who needed their skills. The combination of present purpose and future hope created a sense of completeness that had been missing during the uncertainty of active combat. The wedding took place in January 1946 in a small church near Frankfurt, attended by fellow medical personnel who had shared their wartime experiences. Lieutenant Colonel Patterson served as Kate's matron of honor, while Sergeant Mueller stood with Thomas as his best man. Today we celebrate not just the union of two exceptional medical professionals, but the triumph of love over the chaos of war, the chaplain observed during the ceremony. Kate and Thomas represent the finest traditions of healing and devotion that will serve them well in marriage and in their continued service to others. The words captured the essence of their relationship. Love that had grown stronger through shared service and mutual respect, creating a foundation for marriage that could withstand any future challenges. Their honeymoon consisted of a week in Switzerland, where they could temporarily escape the responsibilities of military service while enjoying their first extended time together as husband and wife. The peaceful mountains provided a stark contrast to the battlefield conditions where their love had developed. "I keep expecting to hear artillery in the distance," Kate confided as they walked through alpine meadows unmarked by war. "We're safe now," Thomas assured her. "We can start building the life we've dreamed about." The transition from military to civilian planning occupied their final months in Europe. Kate received her discharge in March 1946, followed by Thomas in April. By May, they were traveling across the Atlantic toward the new life they had planned during long nights in field hospitals and aid stations. The clinic in rural Wisconsin exceeded their expectations, providing opportunities to serve a community that genuinely needed their medical expertise while allowing them to practice the kind of comprehensive family medicine they had envisioned during the war. "Mrs. Morrison," Thomas said, with a smile that never got old as Kate finished examining their first civilian patient, "how does it feel to be treating patients who weren't injured by enemy fire?" "Different," Kate replied thoughtfully, "but just as important. This little girl's ear infection matters just as much to her family as those trauma cases mattered to the soldiers we treated." The insight reflected their shared understanding that all healing was significant, whether performed on a battlefield or in a peaceful clinic. Their wartime experience had prepared them for civilian practice in ways they were still discovering. Years passed in a blur of medical practice, community service, and family life. Kate and Thomas had 3 children, Robert, Sarah, and Michael, who grew up hearing stories of their parents' wartime service and understanding that love could flourish even in the darkest circumstances. The silver locket that Thomas had given Kate, during their engagement, hung in their clinic office, a reminder of promises made and kept. The simple piece of jewelry represented not just their personal commitment to each other, but their shared dedication to healing that had sustained them through war and continued to guide their civilian practice. Do you ever regret choosing medicine over other possibilities? Kate asked Thomas one evening as they reviewed patient charts in their home office. Never, Thomas replied without hesitation. Medicine brought us together, allowed us to serve others, and provided a foundation for the life we've built. I can't imagine anything more fulfilling. Their children understood from an early age that their parents had met while serving their country, that love could grow in the most challenging circumstances, and that dedication to helping others created meaning that transcended personal concerns. As they aged together, Kate and Thomas would often reflect on the extraordinary circumstances that had brought them together, and the ways their wartime partnership had shaped their civilian marriage. They had discovered that love forged in crisis could last a lifetime when built on mutual respect, shared values, and common purpose. The clinic they established continued serving their rural Wisconsin community for decades, eventually being taken over by young doctors who had been inspired by the Morrisons' example of dedicated family medicine. Their legacy lived on in the countless lives they had touched, and the model they had provided of medicine as both profession and calling. The stories of their wartime service became family legend, passed down through generations who understood that even in humanity's darkest hours, love and dedication to healing could triumph over hatred and destruction. Kate and Thomas Morrison had proven that some bonds forged in war were strong enough to last forever. The courage and love of medical professionals like Kate and Thomas Morrison helped heal a world torn apart by war while proving that the human spirit's capacity for both healing and love knows no bounds. Their story reminds us that in our darkest moments, we often discover our greatest strengths and deepest connections. If you're moved by tales of wartime romance, medical heroism, and the extraordinary people who found love while saving lives during World War II, subscribe for more stories of courage, compassion, and the enduring power of love to triumph over adversity. Each story reveals how ordinary people became heroes when humanity needed them most.